Chronic obstructive pulmonary disease (COPD) is the disease of airways, small airways, also some extent large airways, and also alveoli. And there is a destruction of the alveolar wall along with the narrowing of the airways because of the mucus. These patients get recurrent cold and cough and they get infection. The biggest cause of chronic COPD is smoker. But remember, we have got large number of non-smoking COPD, and that is related to the pollution at house, indoor pollution, or even outdoor pollution at working place. Indoor pollution is very common in our rural areas because of burning of biofuel, and that is really responsible for a large number of COPD patients in our country. Now, we all know that COPD is a leading cause of morbidity and mortality in India. We are the world leader in COPD, like in diabetes. And we have to see that we should prevent this COPD by educating the patient regarding the causes of COPD. Yes, there is a genetic reason as well that we can get exposed to this agent. We get COPD much faster than people who are having no genes about development of COPD. But it is important to know that childhood infection, lower lung volumes in childhood. So you can imagine that COPD is not disease starts at the later age, but it starts in the younger age by recurrent infection. The lung capacity goes down, and low lung capacity or volumes is also important cause of developing COPD in adults. So prevention, not only smoking point of view and fuel load pollution avoiding, but also preventing childhood infection, treating our asthmas better in childhood may be important cause of preventing COPD. Drugs are not the only thing in management of COPD. What is very important, as I just discussed, is prevention. It's very important. Smoking cessation and pollution. How our village female who is cooking will have a fuel, gas or pollution-free fuel, so that the children and she will not get exposed to fuel. So good methodology of chullas, scientific chullas which will reduce the smoke inside is very important. The government is helping all the people who are interested to put it in the village house. Second important is using the natural energy like sun energy and wind energy to prevent the pollution is also very important. So this is as well as the prevention is concerned. Second important prevention and treatment of COPD is concerned is taking vaccines. All our COPD patients should get vaccinated for flu and pneumonia and other DPT vaccination and even shingles vaccination as per the world guidelines, because recurrent infection versus the lung function. So our lung functions of the patient should be preserved, and this is important because we can avoid a lot of complications of COPD. Commonest complication of COPD is recurrent hospitalization, recurrent exacerbation, and that is very important, which further drops the lung function. So this is about the prevention part. Now, as well as the holistic approach is concerned, vaccination I suggested just now, all adult vaccination is important. Next important thing is that pulmonary rehabilitation. Our COPD patient, though they are on proper treatment as guided by the chest physician, they should always start continuing doing physical activity, exercises under the supervision of cardiopulmonary chest physiotherapists, so that they will have good quality life. They always will stick to the good lifestyle. The exercises will improve their capacity to breathe, their 6 minutes walk distance, they could walk better, their oxygen in the body will be better, so they will not feel breathless. And obviously recurrent hospitalization can also be prevented by joining these patients to a pulmonary rehab program. So vaccination, pulmonary rehabilitation, prevention of COPD. The fourth important thing will come is yoga, pranayam and breathing. Yoga is very important way because it decreases the secretions in the upper respiratory tract by Anulom Vilom, Bhramari Pranayam and Omkar, etc. They will have much better autoimmune response to the stress, and they will have much better breathing techniques. The oxygenation can be improved. Remember, all COPD patients should know that energy is generated by not by just food but by oxygen. So if they improve their oxygen level in the blood by exercises and by yoga pranayam technique, the utilization of the oxygen can be done much better. The heart rate, blood pressure can be controlled. So yoga pranayam and meditation will help them a lot to reduce the stress factor. Today oxygen is available in the very free form in the atmosphere, but COPD will, and the patient whose oxygen levels are low at certain level, under the guidance of physician, they should measure their oxygen saturation at rest or by doing arterial blood gas at resting position when they are good condition, and that can guide us whether our patient requires oxygen therapy or not. Okay, the oxygen therapy will improve overall quality of life of the patient. The multiple organs will get adequate oxygenation that can help them to prevent right heart failure, neuropsychiatric manifestation, polycythemia, etc. and all that. So oxygen therapy comes, and that dose also should be properly, not just for the namesake. The proper minimum 12 to 14 hours of oxygen therapy, maybe more, is required as per the patient's oxygen level. After the oxygen therapy, the next comes is improving the sleep quality. Okay, so patient with COPD, if they have sleep disorder breathing like sleep apnea, they become much more symptomatic, they become much more complicated, and in such patient a CPAP or a BiPAP machine after proper evaluation may help to improve the quality life, and frequent they may have better quality of sleep also by using CPAP. So these are the few things which are important as a holistic approach is concerned in management of COPD. Chronic obstructive pulmonary disease is the leading cause of morbidity and mortality in country. I think we are leaders in the world about the COPD is concerned. And if you see the all epidemiological data, the COPD become very up in the list as well as the literature is concerned.